Breast cancer. We hear a lot about it, and it's mostly thought of as a woman's disease, but it's important to know that men can get it too. And joining me today are Michael Liston, a breast cancer patient at MedStar Health Cancer Network, his wife Lisa, and Dr. Shweta Kurian, hematologist and oncologist at MedStar Health. Welcome, you three. I'm glad to have you here.
Thank you for having me.
So, Michael, I want to start with you. How did this all come about? What did you start noticing?
Basically, I started noticing itching.
Itching.
Burning when I put my seatbelt on.
Okay.
And it went on for a while. So that's basically where it started. It went on for like 2 or 3 months. I just thought it was going to heal up. I thought maybe I just hit something or
That's
something.
what ran through your mind? What did you think it was? Like just irritation?
Irritation. So I moved the seatbelt over and being like a man, just say, okay, it's going to go away, but it never did.
Guys ignore things, yes, but after a while you ignored it and you were like, I can't ignore this anymore.
Right, so we went back to the regular doctor. She's turned me over to a dermatology. He gave me some cream. He just thought it was just dry skin, so forth. So I used that for a while. That seemed not to work anymore. Then we went back later in time back to dermatology for the second time.
Right.
I saw another guy there, and he started feeling around my breast.
And what did he notice?
It was a lump there, and he said.
You noticed a lump there.
And he asked me, because I'm basically a person that, you know, just shower, you don't really
feel around. I think a
and,
lot of people
and
don't.
so forth. So I never knew that. And he says, did you ever notice? And he said, well, feel that. I said, no, I never actually went through that extreme. You know, and he said, there's a lump there. So that's what started the program.
And for you, this hit close to home because your mother had breast cancer, correct?
Yes, she went through breast cancer, lung cancer, and it finally went to her bone last year.
I'm so sorry to hear that.
Thank you.
And with you, when you heard breast cancer, it was probably the last thing that you thought of, because you knew it affected your mom, but you probably weren't thinking for yourself.
Exactly, because, you know, you don't even think things like that, you know. You're just thinking, you know, I was getting close to being 60, and I thought, well, you know, I've been healthy. I have never been in a hospital. So it's just got to be a little irritation, but it didn't turn out to be that.
And Dr. Kurian, I'm sure this is something, Michael is not the first person to sort of dismiss these symptoms, correct?
You're absolutely right. You know, it's not common in men. Breast cancer is very rare in men. If you see the statistics, over 260,000 women will be diagnosed with breast cancer in the United States for 2019. But when it compares to men, it's 2,600 men, so it's 100 times less common. Not many people, not many physicians would have seen patients presenting with symptoms the way Michael did. And so it's very hard, and it's very easy to miss and hard to diagnose. You present with merely the symptom that Michael presented with, itching of the nipple area.
Right.
And you know, you think it's a skin thing. Breast cancer is not very common, so even the physicians are not thinking outright, oh, it could be a breast cancer. But these are some of the presenting symptoms of breast cancer. Itching in the area of the nipple area. You feel a lump, some nipple discharge, or you feel lumps in the armpit. Some of these things, if you notice any of these things, I think the patients should start asking their physicians, could it be breast cancer? Could I get a mammogram? Could we look into this a little bit more?
That's what I was going to ask you next. Can men get mammograms as well, and should they be getting them?
Absolutely. So if you present with symptoms, then yes, your physician should send you for a mammogram. Breast tissue is not as big or as developed like a breast in a female breast as when you compare it to men, but they still have breast tissue there.
Right.
And so you can do a mammogram and look for changes. It's not recommended as a screening procedure the way it is recommended for women.
Right.
But if you present with symptoms, yes, you should go for a mammogram. If there is a lump, you will go through an ultrasound to see what that lump looks like.
So follow your symptoms. Basically, if you are presenting something, follow that lead and investigate it more. Lisa, I know this has also been a journey for you, being Michael's wife. Talk about that and what you've experienced through all this.
It was a shock. I mean, I do have to say that it hit me out of nowhere too, with breast cancer in Michael, and it has been hard. I mean, there are so many things that somebody goes through as a caregiver, I believe, when someone has cancer that, I mean, it's tough, you know. You see this person
want to help.
And again, you know, you can only do so much, but you try to do everything. Everything changes. I mean, your appetite, the type of food you like, everything
And I don't
changes.
want to speak for Michael, but Michael, you told me you're doing very well, so I'm
Yes.
assuming that Lisa's part of that as well.
Yes, both of these ladies have been a great help to keep me going strong and forward and recovering.
And where are you with your treatment now?
I am complete with everything.
So you've been treated and you're
Everything's
clear.
clear for the time being.
That is
so.
wonderful.
He has another mammogram scheduled for the other side in October, and every 6 months blood work.
And that's what he should be doing, is staying on top of it.
Yeah, so
Right.
Michael, when he was diagnosed, he had a biopsy. He went through surgery, chemo, radiation, and now he's on endocrine therapy.
All right.
And
so people, as they want to get more information, tune in to WMAR2 today, starting at 4:30 for our live House Calls event, and you can ask all of your questions. Thank you so much for being here and for sharing your story, and we'll be right back with more Midday Maryland right after this. Stay tuned.